Right, good evening, everybody. My name is Dr. Eseza Nambassi, and we are having another session of Applied NeoLife, where we try to understand and really get down to knowing how to best share our stunning products and our amazing business opportunity. However, I will just focus on the products today, and I've called it the heart of the matter to refer to the cardiovascular system. And as you can see, I've said we are prioritizing structure in order to have great function of the cardiovascular system. It is so important to know that the structure of anything is what keeps it working well. Just as a reminder, and if there are any guests, you're all welcome. Our vision is to end the trend of chronic disease. And we can only do that if we become very intentional about ending the trend. And so let's go back to some basics. Cardiovascular diseases are the leading cause of disability and death worldwide. That alone should get us to think about the structure of the cardiovascular system and how we can maintain it right from the beginning. Also, I'm concerned about the amount of resources, both financial as well as the human resources, in real terms, the emotions, the suffering that go into treating cardiovascular diseases. The cost is truly astronomical. So my conclusion over the past many years that I've been in medical practice, over 30 years of observation, and now being convinced that really there's another way we should be approaching it. My conclusion is this, that we urgently need a paradigm shift. We need to shift our thinking and look at the basics, the original forms of looking after our health, which are nutritional. So nutritional approaches should become a part of our overall lifestyle overhaul, not simply medicating everything away. So what is the most important first step to address in order to have an overall lifestyle overhaul? I believe that's it, our mindset, our mindset. And if you are a guest here, there's a lot of mindset shifting that has to happen before you truly grasp what we hold in our opportunity and what we have in our hands. So if you are a distributor and are already involved, that goes for you as well. There's a lot of mindset shifting that has to happen, so that I'm trying to answer, by the way, the reason for this series, because we as medical doctors keep on getting the question, doctor, what can I give if? Or doctor, my uncle has this condition, what do I give? So that's all part of the mindset shifting that has to happen. We move away from medicating and even using our supplements as medication, and understand that they are indeed nutrition and food. Okay, so your choices matter big time. And these are the questions I'm asking. Are all supplements equal? Are all detergents the same? And so for the guests, I'm sure you're wondering, what do detergents even have to do with this? Does it matter what personal care products you use? Well, those are some of the things that we need to look at. Okay, May I request all of you to politely, because if interruptions continue, I put people out of the room. Nyakato, please, if you don't mind. Okay. So, and that's because it damages the recording. Okay. I'm not just being mean. I just don't want a recording that is interrupted. Okay, so your choices do matter, and it matters what detergent you use. All detergents are not the same, and all supplements are not equal. And that's what we are here to share in our session of sharing NeoLife. Now, I first want to bring up the concept of inflammation. Inflammation is when the body's response to an irritant. That irritant can be an infection, viral, fungal, bacterial. It can be some sort of trauma like a burn or a fall or whatever. It can be something from within, such as the development of abnormal cells from normal cells that turn abnormal, as in turning malignant. So all those can be manifesting as inflammation, either as the trigger or they manifest the cause of inflammation. So the cardiovascular system, what we want to learn today is ways to increase resilience so that the system does not break down. The challenge with the way society has developed is we wait for problems and then we react, instead of having a strategy to avoid those problems so that our bodies can serve us well into the future. All of us want to grow old and healthy, not old and sick. But when we look around, unfortunately, we see that there definitely has been a breakdown of the systems, and that's because of loss of resilience. So I want to describe the functions of the cardiovascular system: transportation of oxygen and removal of carbon dioxide. It also transports nutrients and removes waste. Fights disease, transportation of hormones. Hormones are those chemical messengers in our bodies that keep us alive, keep us going. They fluctuate from day to day. They might even fluctuate from minute to minute. And as we grow, let's say from childhood into adulthood, the hormones also change. And then it's important in regulating body temperatures. All these are important functions. I'm sure there are many, many more, but that is just a summary. And so, ladies and gentlemen, I want you to consider this. The promise to yourself when you choose to take greater responsibility, and that can manifest as learning what to do and then doing it, learning what to eat and then eating it, learning and responding by taking action, is that you will be able to rejuvenate your body and to revitalize various systems throughout the body which are impacted by the cardiovascular system. That is the whole of you, in short. And then you will be able to renew. It is totally possible to renew various tissues. For example, the skin. It is possible to defy the aging process if you handle well what you've been given. And then, in short, you can regenerate. It is possible. And that is why we say in our opportunity that we truly think that our vision is to end the trend of chronic disease. Now, you know, we are all blessed because all this is available to us. Nobody can say, I was never given sunshine, or there's no way I can get water. Well, some people may not be able to, but by and large, all these are things that we need to do and take responsibility for appropriating because they are available. Healthy food is a choice as well. Resting is important and it's a choice. So for great health, all these are our responsibility. The diet, the fact that we need to rest and have adequate sleep, the fact that we need to exercise. Sometimes we forget this because of the way modern lifestyle has gone. Even a short distance of walking is too much. And all those impact on our cardiovascular system. And then stress management, very important, and supplementation. That's what we in this opportunity are most famous for, the fact that we have the world's leading supplements. Many of us believe that. So when your body speaks to you, it has a certain language that it will speak in, and it will give you these messages, such as persistent symptoms of sickness. It generally means that there is something wrong somewhere. Okay, so what I'm trying to do here is to discourage us from always reaching out for those medications that stop symptoms, but to look and ask yourself, what am I consuming? Perhaps where I live, what am I breathing in? Or if I'm smoking, what am I smoking for that matter? And then think about what you think about, because that is a big cause of stress and therefore inflammation. And then if your environment is not compatible with health and wellness, for example, you hang around with toxic people, thinking toxic things and saying all sorts of things that will inflame you, perhaps you might need to consider changing. So yeah, that is what that is referring to, your body's language and the messages that they say. And all those impact on your cardiovascular system. And I've intentionally decided to approach this big system from this perspective so that we stop asking the question, doctor, what do I do when? I'll give an example. I'm sure many of you have seen people who generally look healthy, but they have swollen feet, and the feet just remain swollen and they accept it as their normal. Well, that is a glaring body's sign language and message that there's something not right with that system. Maybe the veins are leaking and they're leaking out a lot of the fluid into the space outside the blood vessels. So that's an example. But let's start by looking at what could possibly go wrong with the heart. The heart is central to the whole system. It is more than just a pump, but let's consider it a pump. What could go wrong? For example, in there are valves. If for whatever reason they become stiff, then they won't be able to close properly and they will leak. And a lot of people accept it as, oh, well, it's part of the aging process. It shouldn't be. Let's say an aneurysm, that is ballooning of a section of the blood vessel. It can be anywhere, and that's akin to a varicose, which can rupture, can be serious. But why is there an aneurysm? Okay. And then cardiac arrhythmia, for example, the heart isn't in a proper rhythm. That is something wrong with the pacing of the rhythm. There's an internal pacemaker. It's got a long name, sinusoatrial node. But if it is faulty, it could be that it isn't getting the right nutrients. Remember, we are talking about structure, good structure in order to have great function. Cardiomyopathy, if the heart muscle is just flaccid and sick and not pumping very well. Pericarditis, that is the lining around the heart itself. It can become inflamed. Wherever you see itis, like dermatitis, arthritis, okay? that means there's inflammation. Our responsibility to ourselves is to find out why that inflammation is happening and to see how to help the body to overcome that inflammation. Dilated ventricles or fatty deposits in the blood vessels, all these can affect the heart per se, and then it can affect other parts of the entire system, the cardiovascular system. And I hope at the end of this presentation, you'll be able to connect dots and see how you can truly help people to think like you will be thinking, looking for the foundations and addressing those foundations, okay? So let's go on. This is what normally happens as people age and as people's diets that they are using promote this kind of fat deposition. A normal artery is supposed to be nice and clear so that there's nothing to impede flow of blood. However, if after a while there's this kind of collection, I want to describe what could be going on. Let's say this blood vessel, because it works hard and it is against or supplying the muscle of the heart, and it is expanding and relaxing and contracting and expanding, yeah, moving all the time. But if this is muscle, there's these linings, they need to be fed, they need to be constructed well, there has to be enough collagen. Collagen is that building material that goes throughout our body in all tissues. Now, if the collagen is not well built, then tears will happen throughout. The body's response to that is an inflammatory response, and it comes with a plan to try and stop those tears from expanding. So it will lay down this lipid deposition, and we call it plaque. It is full of fat cells, it's full of inflammatory cells, it's full of minerals like calcium. And after a while, this becomes hard, but you notice it is not as high as it's not as free flowing as it might be. It is smaller, and with a smaller place for the blood to flow, the next thing that happens is blood pressure goes up. So chronic blood pressure that we call hypertension will lead to a lot of problems that we see as an end result of poor construction of the cardiovascular system. I hope you are all catching my line of thinking. So we see things like strokes, we see things like eye damage. We've talked about blood vessel damage. That was what we were chatting about just now. Heart attacks, when the coronary arteries that supply the heart vessel themselves are blocked and can no longer supply the heart muscle. Heart failure, kidney failure, you name it. Even simpler things like the legs not getting enough blood, and then they become inflamed and swollen. So we need to think broadly. I hope not too frighteningly, but yeah, we need to think broadly. So in this slide, I say, let us take a real hard look. What is real prevention? What is it? And can food be the answer to reversing most common forms of degeneration? I'm asking all these questions and I want you to think about them. And what else does the body need for optimal function, maximum function, the best function it can have? And when should we begin? That's a very good question. All those questions are thought-provoking, and that is the purpose of this series. I think we should begin with the children and before the children are born, because studies now prove that a lot of children are set up prior to their being born for cardiovascular diseases later in life. So the responsibility is huge upon each one of us, in fact, upon the whole of society, to choose wisely long before they are born, because some of these foods might need to be supported by dense nutrients that can only be found in good supplementation. So yes, this little picture is just to remind us that cardiovascular, the medical industry and the pharmaceutical industry to have a reason to exist, because a lot of people suffer from cardiovascular diseases. So now let's shift gear a little bit and talk about nutrition supplements. Are all nutrition supplements equal? And does it really matter what I use? Now, for the guests, those of you who are guests on this call, I'm sure you were asked to have a look at what we offer, and you may be asking that very question. I hope we can go some way into answering it in the next few minutes. I want to start by describing the concept of bioavailability. Bioavailability is a term used to describe the proportion of a food or a medication which enters the circulation when introduced into the body and is thus able to have an active effect. Active. It does exactly what it is intended to do, and a lot of it is available to do that. Alternatively, you can say the degree to which a nutrient is available to the body for use. It's a measure of the rate that a supplement is absorbed within the body after it has been ability up, because there are lots of supplements out there. There are lots of medications too. And a lot of society, many people in society don't know how to be discerning, and hence this series. So researchers have found that many products that are marketed as dietary supplements actually contain hidden active ingredients that are either unsafe or unstudied. So, whom to trust? We decided a long time ago to trust people who have a history of scientific excellence, people who have the experience and the heart, the consciousness to present us with products from food, because primarily food is highly bioavailable if it is real food. And so we have a scientific advisory board in this company, which has a lot of credentials. Let me leave it at that. But it was founded by a top toxicologist and pharmacologist, and he was a pioneering researcher in oral chemotherapy, oral cancer treatment. So a lot of people's lives are due to his pioneering work. But then when he came across to NeoLife, he said that he wanted things to be totally organic, totally non-GMO, and with no chemicals that would then cause more harm than good. And so we are very proud to have the leading whole food range that you can find anywhere. And we want to share it with you. First of all, they pioneered the concept of cellular nutrition long before it became famous. And all nutrition should start at a cellular level. That's where it should begin. So we have this product. It is the foundational product. It is in our core nutrition. It's called TRENN. It enables the cell membrane to be constructed correctly. And I've said that we are talking about structure and the construction of us in order that our cells and our system that we are discussing today, called the cardiovascular system, functions well. And I just want us to connect those dots between structure and function. And now that is going to be my thread as I introduce various products. Those are the core nutrition. And in the previous series, we've been discussing the importance of starting with core nutrition. Right, it looks like that. There is your TRENN in there, but we also have omega-3 salmon oil. We have the fruits and vegetables, real fruits and vegetable extracts, and the vitamins and minerals. So this is core, along with the protein that is actually 22 amino acids plus all. And so our food pyramid is fully covered by what we get in the core nutrition, as you can see over there, okay? Plus the vitamins and minerals. Targeted solutions for cardiovascular disease. Now I'm going for discussion. We've discussed core nutrition. Let us look at targeted solutions for heart disease. I started with this on purpose because after discussing inflammation and the effects inflammation has on various cells and tissues and organs, from time to time, you need to develop that discipline of doing a regular detox. And if you're new to the program, you will learn about it in the trainings that we have. And for the distributors that are here, I hope that is what is happening currently. But we have garlic. Garlic is very important. Apart from detoxing, it also helps to keep the blood nice and free flowing through those blood vessels. It is antimicrobial and therefore reduces possible causes of inflammation. And then we have Betagard. That is a world famous, and it was the first product that our founder of the Scientific Advisory Board formulated. It is an antioxidant full of minerals and chelating minerals that actually, when we detox, we go a long way to helping the body. Then the other thing I mentioned was we need to start early. So we have the children's basic core nutrition, but on top of that, Vitagard is full of antioxidants, which have been found to be crucial for heart health. And so by starting early, giving them carotenoids and flavonoids that are found in here, as well as the minerals, we are actually helping our little ones to maintain a good cardiovascular system. And later on, they graduate to the other ones. So important for cardiovascular health also is lipotropic adjunct. That is lipotropic factors that help to get rid of those fatty deposits within the blood vessels. And therefore, when that happens, the heart will not have to strain so hard to push blood around the body, because the blood vessels will be nice and clean of all those deposits. So that one is important. Then we need vitamins and minerals, and I've chosen these three on purpose. Two are what we say fat soluble, but I won't differentiate that. Vitamin D, very, very important for overall health. Vitamin E increases cardiovascular function by increasing the amount of oxygenation that is carried around. Very important in heart health and cardiovascular health. Then vitamin C, one of my favorite vitamins. It is crucial to have enough vitamin C on board to build blood vessels that will function well. So that is why we have vitamin C in the heart and blood vessel maintenance system. So let me develop this further. So we do need vitamins, and we need the B vitamins as well that you've seen in lipotropic adjunct. Then we need minerals, and I've just pointed this one out because it helps with stress. And we all know that stress is one of the big things that leads to cardiovascular, the cardiovascular system failing. CalMag has magnesium in it, promotes a lot of muscle relaxation, and you can also get magnesium on its own to relax muscle. And I say that because we always have to remember that you find muscles in the blood vessels, but particularly the arteries, the ones that carry blood away from the heart. Those are quite muscular, and that muscle needs to be maintained. And already all these are assuming that you have your core nutrition in place, because then you get the 22 amino acids. Then the heart requires a lot of energy. You know, the heart has lots of these little things that we call mitochondria. Each cell, each one of the cells of the heart may have about 5,000 or more mitochondria. Mitochondria are the energy producing cells. Unfortunately, as we grow older, our cells become less capable of making coenzyme Q10, CoQ10 as we call it for short, is what supplies mitochondrial energy. It is made by our cells, but as we age, the capacity to make it declines, and hence the need to consider supplementing. All these are possible if you know why you're doing something, right? So yeah, by the age of about 50, our capacity to produce CoQ10 within our cells has dropped to about 50%. So that's why we tend to see heart disease begin to develop after that. So to stop that, we need the energy. But now today, I want to point out this particular product. It's called flavonoid complex. It is a product that I'm sure not everybody is aware about its importance and how powerfully it can change the course of the cardiovascular system. But I want to quickly look at a few things about flavonoid complex. NeoLife was the first one to put together a product that has over 4,000 flavonoids, not just the one that is most abundant called bioflavonoid, but in here there's a lot of extracts, for example, from green tea, which has been found to preserve the cardiovascular system of the brain, and therefore berries, which has been shown to help the cardiovascular system and other tissues in the urinary tract system, in the whole of the urinary tract, and therefore encourage better function of that. And on it goes. So this is amazing, but what really captured my attention about it is the fact that it improves the utilization of vitamin C by a huge factor in order to build collagen. And remember, collagen is that structural tissue, the structural element throughout our body, but particularly in our cardiovascular system. And so when you have great structure, you also get wonderful function. And that's why we need to encourage maintenance of the great structure that we want to have. So flavonoid complex comes in this pack over here, or it can come as a standalone. But I want you to look at all the peer-reviewed studies on the role of flavonoid complex. It's important in blood sugar balance. That blood sugar balance is important if you're to control inflammation. It's important in cellular health. It's important in cognitive health, important in eye health, heart health, immunity, skin health. In people who do a lot of sport, it is a very important antioxidant, and it has been found also to relax blood vessels sufficiently. It dilates blood vessels so that the blood flows through, and therefore lowers blood pressure. It's an amazing product. But in phytodefense, you get 3 carotenoids, 2 flavonoids, which is the optimal serving, and a cruciferous. So you get what nature intends for us to get in there. So as I purpose of us following through onto the core nutrition is to show ourselves and our guests that it is possible to NeoLife your home and to have a business of sharing with other people. So let's share NeoLife. Thank you very much. Please let us stop outsourcing our health. I'm going to stop sharing and invite you if you have any questions.